What's unique about Retina Consultants of Texas is that you can get the very best quality care here. It's very well known for being on the cutting edge of research, for being able to provide innovative medications.
The research and the clinical trials that we do allows us to be cutting edge. It allows us to look at sort of the newest, the greatest, the next big thing out there.
We definitely wear two hats, and we're all involved both in clinic and research, and see research patients intermingled within our clinic itself.
So we can both take care of a large number of patients on a one-to-one basis, but we can also make a broader impact through research.
It's intellectually stimulating for us, but it's also exciting for our patients because they have the option and the opportunity to get access to some of these cutting-edge treatments and trials.
Aggregating research alongside clinical centers is absolutely paramount and absolutely critical. And I think what we've been able to do here at Retina Consultants of Texas is amazing. It's fundamental to changing the game.
The therapeutics that have evolved over the past 10 to 15 years have really changed the game and really allowed us to protect eyesight and even reverse vision loss and restore quality of life to a lot of our patients.
A lot of the medications that we actually use now were developed in trials that were run here at this practice.
All the research is like top of the line and published in the top journals, and real investigations that lead to change in what we really practice day to day in clinics.
Being part of one of the largest research centers in retina in the nation, we're able to find new drugs that last longer for the patient, that are safe for the patient. As long as we can continue to push the field forward, we'll always be finding new medications that can help provide our patients with the best treatment, the best vision.
What that does for patients is it speeds up access to those novel developments. And so the pace of discovery really can be significantly shorter. And so to me, in our ultimate goal of fighting against blindness, I think it just speeds up progress.
It's really an amazing feeling to be able to offer the benefits of this clinical research to our patients directly.
You just really have a more holistic understanding of things, and you can achieve more, you can treat eyes better if you have the ability to do clinical research.
We have the advantages of the efficiency of a private practice, but we really have the research depth of an academic center. We're fighting that fight to try to get more medications available that are FDA approved so that patients have access to treatments that can save their vision.
The nice thing about being heavily involved in both the research as we did and the ongoing research is that now that we have mechanisms that work, we're trying to find a better mousetrap.
There are new diseases that we can't treat now that 5 years from now we will be treating. There are hereditary conditions that right now there's nothing we can do. 10 years from now we will be treating those patients. So it's an exciting time to be in retina.
As a retina specialist, the last thing you want to do is tell a patient there's nothing I can do for you. Because of clinical research trials, we can offer hope and new treatments and new opportunities for patients.
If you see a patient in clinic who you think might benefit from being in a trial, often for certain diseases that we don't actually have treatments for yet, you give them new opportunities that wouldn't otherwise be available to them.
Although we've made great strides in the past several years with new medications that are available to treat these conditions, there are still areas of improvement and there are still ways in which we could help these patients more.
The impact of having so many of us come together and work together is that we can do things we couldn't have otherwise done before.
Whatever we discover in those clinical trials is going to have a major impact on the way patients are treated, not just across the US, but across the world.
At the end of the day, that's what we're trying to do, is provide the best care to people possible and to maintain vision.
We have greatly decreased the amount of blindness worldwide with the developments that came out of the research labs and then our clinical research programs. However, we're not done yet. There's still people going blind. There's still patients we catch too late. There's still surgical procedures to be developed, drugs to be developed, and techniques that are going to continue that evolution.
But one of the themes that unifies us as a group is our true dedication to advancing this field for the betterment of our patients. There's always a way to get better, in my view of things. So we are unified in the concept that we're doing better today than we did 5 years ago, and that we want to be doing better in 5 years from now.